My name's Girdler. I'm an orthopedic spine surgeon. I deal with all areas of the spine. So that's everything from your head all the way down to your sacrum and your low back. Anything from small surgery all the way to complex surgery, including things like revision surgery and deformity correction. My wife and I and our 2 kids, we just moved to Los Angeles. Most recently, we were living in Minnesota, and before that, we were in New York City for 13 years. So I'm excited to get started here at DISC and to meet the people of Los Angeles. I started my educational journey really in New York City, moved there right after high school, went to New York University, and after college, I went to Albert Einstein College of Medicine, just in the Bronx. And after that, I did an orthopedic surgery residency at Mount Sinai Hospital. During residency, I was always interested in spine. I loved spinal anatomy. I loved being able to really help people who had problems with their neck and their back and a pinched nerve and relieving that sort of pain. And so I decided to do a spine surgery fellowship at Mayo Clinic in Rochester, Minnesota. I feel very fortunate that through that training, I am able to offer care to people kind of on the entire spectrum of spinal pathology. The first time I meet someone, I want to introduce myself, I want them to know who I am, and I want to get to know who they really are. I want to reassure everyone that I meet that the good news is the vast majority of people who meet a spine surgeon will never need surgery, and that we can treat almost all spinal conditions with conservative treatments, things like physical therapy, anti-inflammatory medications, acupuncture, chiropractic, and these sorts of modalities, and try to stay away from the operating room. In the few cases where those things are not sufficient, then we have a whole host of options to address problems that need to be addressed surgically. Those span everything from the smallest of small surgeries that can be done in 30 minutes at an outpatient surgery center with an incision that's 2 centimeters long, all the way to large complex surgeries done in a hospital. So there's really a huge breadth of surgical intervention that a spine surgeon like myself can offer. I'd say my personal philosophy would be to do the least invasive thing to give them the maximal benefit and the best chance at returning to their daily life, their activities, their sports, living the life that they want to live. There's a whole host of surgical options that I can offer patients, things like decompressions, and we do that in a minimally invasive technique where there's a very small incision. Patients are able to return to activity just a few weeks after surgery. All the way up to spinal fusions, both in the low back, anterior neck fusion surgery, ACDF, cervical discectomy and fusion, as well as disc replacement, including cervical disc replacement and lumbar disc replacement. And there's some new motion preservation surgeries, one called the TOPS procedure that I'm very excited about. It's a facet replacement, facet arthroplasty. These are conditions that would traditionally have been treated with the fusion procedure. That's a much larger open procedure. I still do that procedure, and I think it's a very good procedure, but for select candidates who qualify for the TOPS procedure, it may be a motion preservation option. Another extremely exciting aspect of spine surgery and the direction of spine surgery is the utilization of so many advanced technologies. One of those is navigation. So utilizing computers and intraoperative CT imaging to guide where we are in space during surgery. And that's something that we have here at DISC. So I think that is a very unique aspect of doing surgery at this specific DISC facility. There's lots of reasons why I'm very excited to join DISC, getting to work with some wonderful physician colleagues here in orthopedic surgery and also in neurosurgery. I think being a physician partner at DISC really gives you the autonomy to see patients and treat patients as you think is most appropriate, but also gives you the support to do surgery in a way that's very advanced, very safe, all within the realm of outpatient and surgery center, which is really, I think, the way forward for spine surgery. When we're not working, my wife's also a physician, and we have 2 kids. Right now they're 4 and 2 years old, so they keep us very, very busy, usually up in the early morning and sports with the kids. So my son loves to play soccer and basketball and, many others. Family life is really what we're doing most of the time when it's not spine surgery. I love what I do. I feel very fortunate to be a spine surgeon. We often see people who are in some of the most pain of their entire lives when they come to see you. They have real problems, whether that be, severe debility, not able to walk, not able to feel their hands or their feet. And in a very tangible, meaningful way, we're able to intervene, and that's extremely meaningful. So yes, I love what I do. I think it's a great profession.